Hello again, guys. This is David Villar, and welcome to the second video on toxicants that produce convulsions. As I mentioned earlier, we are following the order as you will find in Beasley's notes that you can find in IVIS. And on this presentation, the toxicants that are discussed include methylxanthines, water deprivation, also known as sodium toxicosis, amphetamines, cocaine, and tremorgenic mycotoxins. Most poisonings from methylxanthines happen as a result of chocolate ingestion in dogs. And of all the different types that are listed here on this table, it is baking chocolate that has the highest concentration of caffeine and theobromine, about 40 milligrams of caffeine and 400 milligrams of theobromine for every ounce of chocolate. In the horse, cocoa bean hulls used as bedding material has also caused toxicosis. And there are three basic mechanisms of action that appear to have clinical relevance. The most important one appears to be the competitive antagonism of cellular adenosine receptors. As we will see, inhibiting those receptors cause CNS stimulation, tachycardia, and constriction of blood vessels. Another mechanism is inhibiting the calcium sequestration, and the net effect is an increase of free calcium in both the skeletal muscles and the heart. And finally, the inhibition of phosphodiesterase, which basically increases cyclic AMP concentrations within the muscle cells. What we see on this figure is the excitation-contraction coupling in a muscle cell, showing an action potential that causes the release of calcium ions from the sarcoplasmic reticulum, and then the reuptake of those calcium ions by a calcium pump. Caffeine is going to block the reuptake of those calcium ions by the sarcoplasmic reticulum. And with regards to the toxicity in the dog, we can express it in terms of the LD50, but probably from a clinical standpoint, and if you have an animal exposed to chocolate, what is probably most useful is to know the minimal lethal dose of the combination of the all three methylxanthines, and this is about 100 milligrams per kilogram. So when you calculate the dose ingested, you need to account for how much caffeine and theobromine has been ingested. And if the combination of both is more than 100 milligrams per kilogram, you can probably consider that exposure as potentially lethal. What are some of the clinical signs expected in intoxications? Well, the most common and the initial sign is going to be vomiting that usually follows with diarrhea, diuresis, restlessness, hyperactivity, tachycardia, premature ventricular contractions, tremors, seizures, hypertension. And some veterinarians describe the dog that the dog actually bounces when it's picked up and dropped a few inches onto the feed. Death will usually be caused by tachyarrhythmias or respiratory failure. With regards to the treatment, if you have the option to do an electrocardiogram, it's going to be important to control those tachyarrhythmias. We can use lidocaine to effect or as a constant rate of infusion. If this fails, we can resort to using beta blockers like metoprolol. This is actually preferred over propanolol because it doesn't really slow down the excretion through the urine, whereas propanolol does. We can use diazepam to counteract the CNS stimulation and even the seizures. We can push fluids to prevent the reabsorption from the urine in the bladder and also to enhance the excretion. And some references also suggest to catheterize the bladder to prevent reabsorption. And finally, we cannot miss trying to decontaminate the animal. If vomiting has been controlled, activated charcoal can be given and repeated several times. to prevent the enterohepatic recirculation and shorten the half-life of theobromine, which, as you can see here, is very long, up to 17 hours. Now let's move on to the next one, which is amphetamines. In this case, poisoning usually results from the exposure to illicit drugs, and the owner may be reluctant to provide that kind of information. Ecstasy is a combination of amphetamine and other hallucinogenic drugs. Methamphetamine is even more popular than cocaine because the effect lasts longer, and it's also cheaper, obviously. Now, the LD50, it's between 10 and 30 milligrams, but the minimum lethal dose, at least in humans, is as low as 1.3 milligrams per kilogram for methamphetamine. And if we look at the structures of amphetamine and methamphetamine, they resemble catecholamines, and their mechanism of action is actually to stimulate the release of those catecholamines in the central nervous system and the adrenal glands. They also bind to the sympathetic receptors and they activate them, which makes them sympathomimetic agonists. And in fact, they're even more potent than norepinephrine. And finally, another mechanism is inhibiting the monoamino oxidase enzyme within those nerve terminals, and that is going to prolong their action at the sympathetic nerve endings. They penetrate very well into the brain, unlike the natural catecholamines, which are more water-soluble because they have hydroxyl groups. As a quick reminder, on this figure we see the reactions that take place within the sympathetic nerve terminal, which produce all three natural catecholamines, which are dopamine, norepinephrine, and epinephrine. And if we look at the structure of amphetamine, it's very similar to these natural catecholamines, so it's no surprise that it's going to mimic their action. And as I just mentioned, those hydroxyl groups prevent the penetration of catecholamines in the brain, but because amphetamines don't have them, they penetrate very well into the CNS. So in this figure, we have a dopaminergic presynaptic nerve terminal, and the sites of actions for amphetamine. It's going to favor the release of dopamine from their vesicular storage sites. It's also going to compete for the reuptake of dopamine. It's also going to facilitate the release of dopamine by inducing reverse transporter exchange. And it also, but weakly, inhibits monoamino oxidase, which causes an increase in presynaptic dopamine levels. And finally, it may have some direct receptor agonist action. Now, the clinical signs are very similar to what we saw with methylxanthines, which make it a differential diagnosis. It's going to produce central nervous stimulation with hyperactivity, restlessness, tremors, high respiratory and heart rate, hyperthermia, mydriasis, hypertension. I didn't include convulsions here because they're rare, but they can also occur. And also vomiting is not common either. Death usually happens from cardiac ischemia and infarcts. And in fact, people complain of chest pain and high palpitations from the arrhythmias. As with most toxicants, there is no specific treatment. Diazepam is effective in people, so it is probably also effective in dogs. It will control most of the undesirable CNS stimulatory effects. There are some studies in dogs exposed to lethal doses of amphetamine that indicate that haloperidol is even better than chlorpromazine and increased their survival by antagonizing hyperthermia and hypertension. If the body temperature becomes too elevated, it's probably wise to employ cooling methods like ice. And finally, if we can do an electrocardiogram, and if it is consistent with infarcts, we may want to use drugs that break down the clot in the heart arteries, and I included here altiplase. Now let's move on. Cocaine. This is also a natural alkaloid from the coca plant. It used to be used as a local anesthetic, but nowadays it would obviously require to have a special license. And as with the amphetamine, they result from most of the time the exposure is going to come from illicit drugs. The toxicity is not very well established, but it's highly toxic, with an IV LD50 of 39.5 milligrams per kg, but the minimum lethal dose is probably much lower. It works by preventing the reuptake of catecholamines, making it a very powerful CNS stimulant. It also blocks the sodium voltage gated channels in peripheral nerves, and that makes it an excellent local anesthetic. So the clinical signs in dogs include vasoconstriction, seizures, mydriasis, tachycardia, arrhythmias, hyperthermia, vomiting, salivation, and it's usually the cardiac effects that are going to kill the animal. There is no specific treatment. Sorry about that. There is no specific treatment as with most other poisonings, so it's going to be symptomatic and supportive. Seizures can be controlled with diazepam. Cardiac tachyarrhythmias can be controlled with beta blockers like propranolol, or ideally with a more selective beta-1 blocker like atenolol that has a longer half-life in the dog. Chlorpromazine pretreatment actually decreased seizure activity and prevented the acidosis and the hyperthermia in dogs that were given a lethal IV dose of cocaine. Now, if we move on to the next one, tremorgenic mycotoxins and Stargardt syndromes. These are fungal metabolites that contain an indole moiety that produces the tremors and the convulsions in animals ingesting contaminated feeds. There are 5 groups of tremorgens. We have penitrem, paspalitrem, fumitremorgens, veruculogen, and triptokivaline groups. I'm sure I'm not pronouncing all these correctly, but they're listed here. Now, if we start with the first group, the penitrems, we can find them in moldy, refrigerated foods like cottage cheese, cream cheese, moldy walnuts, moldy peanuts, moldy stored grains. And in dogs that get into the garbage can, it's probably the most likely source of exposure. Now, in dogs, the 2 most common signs are going to be tremors and seizures. With low doses, we're more likely to see just tremors, and with high doses, convulsions and death. So we can say that the signs are dose dependent. Dogs may tremor for from 2 to 4 hours after the exposure, and they can continuously have signs until death. Now, if they survive, they usually return to normal over 1 to 2 days. As you can see here, the mechanism of action is by raising the levels of excitatory neurotransmitters like glutamate and aspartate. This increases the resting potential of neurons and facilitates the transmission of impulses across those motor end plates. And it's also suggested that they inhibit glycine, whatever it is. And as you know, it's an inhibitory neurotransmitter that is present in the spinal cord. Now, the differential diagnosis in small animals are some of the convulsive agents that we just already talked about, like strychnine, nicotine, amphetamines, methylxanthines, cocaine. Penitrem on its own does not usually produce vomiting, But if they got into the garbage, it's likely that they also ingested other items that are decaying and may produce vomiting. The treatment includes decontamination procedures like activated charcoal after the animal is properly sedated. We can use diazepam or barbiturates to control convulsions. And there are two drugs that have been tested in mice that are able to abolish tremors by increasing glycine. These are obviously experimental drugs, not typically used in practice, but it's good to know that they're there if and they may be available in the near future. These two drugs are mefensin and nalorphine. Now let's look at some tremorgenic mycotoxins that produce what's called stagger syndromes in large animals. The source of the exposure is obviously going to be forages that are contaminated with molds that produce these tremorgenic mycotoxins. And on this slide we have some of them like ryegrass, Dallis grass, Bermuda grass, and corn silage. Any cereal grains that are contaminated with ergot alkaloids can cause these stagger syndromes. As you can see, the black structures are called sclerosias of the fungus Claviceps paspali, which contain paspalitrems, as we will see in a minute. So the stagger syndromes may have different etiologies, but they have similar clinical presentations. The syndrome is characterized by hyperexcitability and muscle tremors like twitching of the shoulder and the flank muscles, which are enhanced when we disturb those animals. Affected cattle usually have a stiff, stilted gait, ataxia, hypermetria, and may fall easily, and they cannot get up and stand and walk. And because they cannot really get up and walk, problems sometimes arise from not being able to eat and drink, so they can even die from dehydration. Now the signs usually disappear after 2 to 4 days if they're on a clean diet. Now let's look at the different sources of stagger syndromes, starting with what's called paspalum staggers. The fungus is called Claviceps paspali, and it produces paspalitrems A and B. The best way to prevent intoxication is obviously to prevent the consumption of these ergot sclerosias in mature seed heads. The problem is that the sclerosia has not been may not be formed yet, but the honeydew stage may already be present and can be as toxic as the mature sclerosia. The tremors can be either confined to the head or extending all over the body with incoordination, and more severely affected animals may show only mild tremors, but when they are disturbed or forced to move, they can develop incoordination with marked tremors, and they can even collapse. Now I'm going to play a video. Here we can see the neck tremors and the head nodding movements in this heifer. The animal is obviously incoordinated. He is swaying when he moves, and the signs would probably worsen if we were forcing this animal to move. Now on this other video that we have here, we see a lamb that has severe problems coordinating its limb movements. They appear to be stiff, and it's moving unsteadily with those hindquarters swaying, and there is general shaking of the body, as you can tell. The signs in sheep may last several weeks before they make a recovery. Cattle are more sensitive, but they tend to recover much faster in a matter of a few days on a clean diet. Okay, so let's move on to the next one. Ryegrass, in this case the fungus, is an endophyte, which is obviously located within the plant, particularly in the lower parts of the plant, like the stems, The toxin is called lolitrim, which is named after the scientific name of the plant. The animals may appear normal at rest, but when they are incited to move, they show a stiff gait, muscle spasms, and occasionally tetanic seizures. It's very well described in horses. Affected animals usually show a spastic paralysis, hypermetria, which is basically when the movements overreach the intended goal, and tetany in severe cases. Here we have another video, and I'm just going to play it for you.
This videotape has two sections. The first two animals you will see are alpacas that were on a ryegrass, perennial ryegrass pasture and developed signs of ryegrass staggers. They are 6-month-old juvenile alpacas. Note the movement of the alpaca's head, the tremors of the head, and the tremors of the muscle of the neck. This is very characteristic of a moderately severe ryegrass staggers. This animal encountered lolitrim B with perennial ryegrass pasture and developed this condition. After 2 days of being off the pasture, he slowly began to recover. This is the group of the 6-month-old alpacas that the first brown animal was with. There were 6 affected alpacas affected within a few days' time. Note the slight tremoring of the head of the cream-colored alpaca on the screen. Again, removal from the affected pasture resulted in reduction of signs and return to normal.
So there is actually a lot of literature. What are the threshold levels for lolitrim in the diet that will cause tremors? The concentration in horses is not very well known, but for cattle and sheep, the concentrations are around 1,800 to 2,000 parts per billion. Ergovaline is the toxin in tall fescue and ergot produced by Claviceps purpurea on cereal grains, and it's particularly toxic in mares, and because mares are very susceptible, they should not be ingested in the last 60 to 90 days of pregnancy. This is kind of applies, the same applies to tall fescue. We will talk about this ergot in a separate video. And as it happens with tall fescue, as I just said, we can plant seeds of ryegrass without the endophyte. And if that's not possible, we can mix it with uncontaminated feed to lower the concentration of the toxins below the threshold value. And another option is to ammoniate the hay. Now the final one is water deprivation, which is also called sodium toxicosis. The normal diet usually contains between 0.5 to 1% salt, which is, as you know, an essential nutrient, and it affects the palatability of any diet. You need salt. I mean, this is like popcorn. A little bit of salt makes it more palatable. If you put too much salt, there is no way you're going to eat it. So the animals usually tolerate up to 2% of salt in the diet, but they need fresh water. When we talk about 1% of salt in the diet, we are referring to all the different salts, and this is called total dissolved solids. So you have to account for not just sodium chloride, but magnesium, calcium, salts, sulfates. Salt is obviously more dangerous in water than feed because water intake exceeds feed intake, and there is actually no compensatory advantage in drinking more. And in fact, saline waters that can be safe in winter can be deadly in summer months, because the animals are going to ingest, to consume or drink 3 to 4 times more during the summer times. Now in swine, some of the common problems arise when there is a mechanical failure of waterers, medicated feed in the water that makes it unpalatable, frozen water obviously, or presence of poultry wet mash made with whey or brine. For cattle, the typical scenario is when animals ingest an excess amount of salt and they're not near a water source, and this is why the mineral supplements should be placed close to the water tanks. When it's water deprivation in the presence of normal sodium intake, the animal has serious metabolic problems, and when they lose more than 10% of their body weight, they're basically going downhill, and it's not easy to save them after that point. So what's the theory about the mechanism of action? On the top graph or panel, we see sodium in plasma moving or passively diffusing into the cerebral spinal fluid. However, it requires active transport or energy to be removed from the CSF. Now, when sodium concentrations increases in the central nervous system, is going to depress glycolysis, and consequently energy for active transport is deprived. Now on the bottom panel, what we see what happens if the animal has suddenly access to fresh water. In normal situations, the water dilutes the excess of sodium and it's excreted with the urine, and then the plasma sodium returns to normal. But the problem is that if there is too much sodium which is trapped in the brain, it will attract water because of the osmotic gradient, and this actually results in brain edema and the clinical signs. Now the clinical signs in pigs that we describe next are typical of a primary problem of water deprivation. The onset of CNS can start even just one day without water. And all of the following are CNS signs. We have aimless wandering, circling, snout twitches, head pushing against the wall, pivoting around 1 foot, blindness, non-responsive, dog sitting, clonic tonic seizures with episodenous, paddling, and about half of the animals with CNS will probably most likely die even if we treat them right away. Now in cattle, severe water deprivation followed by access to water can result also in severe clinical signs, and as we will see, you have to be careful when introducing water if the animal is already very dehydrated. The signs include belligerent behavior, incoordination, fasciculation of facial muscles, ear twitching, sticking the tongue out with the head outstretched, fence walking and aimless wandering, and obviously convulsions and terminal coma. Now, if the problem is very high salt intake, one would probably expect more gastroenteric signs because of the irritating effects of the salts. So you would probably see also diarrhea with mucus in the feces, vomiting, and they die a lot more quickly in just a matter of a few hours compared to a scenario of lack of water. Now, with regards to the diagnosis, when the animal dies, you want to submit either ocular fluid or brain or both to the lab to measure sodium. The ocular fluid reflects the concentration of electrolytes at the time of death. So if the animal is dead, it's probably a good substitute to what the serum had at the time of death. Brain sodium will also be higher than normal levels. And with regards to the treatment, keep in mind that you cannot let the animals drink all they want. It is important to limit the access by giving small amounts of water frequently, and a rough estimate is about 0.5% of their body weight every 60 minutes. If you give them all they want, you will aggravate the brain edema and kill them. So it's for extremely valuable animals or small animals, what we can do is use hyperosmotic fluids like dextrose solutions that have no sodium, and this has been shown to be effective to treat dehydration, and is actually recommended, as I say, on an individual basis. I'm gonna play one last video, and this is the last slide. So we will continue talking about other convulsive agents on the next video. So until next, take care, and goodbye for now.